Well, I'm really the last speaker before lunch. And I thought that the organizers don't like me. But I have an idea that I'm going to be the finisher of this. And I think my messages are in line with what you have heard throughout the day. First, I don't like my title. This is a proposal I made about 7 years ago to write a legislation to define the workforce for the PDA. And well, we had some discussion, but didn't go through because I thought that there are a number of gaps that we need to address. So I'm going to change the title to Goal-Focused Oral Healthcare Model, which is what we're talking about today. So very important to think about. The reality of it is that if we're going to talk about teams, every team member must be a leader. You need a manager for the team. And as a dean, I can tell you, we do not train our students to be leaders. Neither dental hygiene schools. Leadership and managerial skills are not taught in dental schools very well. People learn them on the job, learn throughout their lives. But if we want to change system, that's one of the things we need to focus on: leadership, communication, and management. So a lot of the ideas you're going to discuss today is what I refer to as standard ideas, things that you have thought about before. And maybe there are a lot of people here who want to promote one concept versus another concept. And I'm always reminded by this quote from Henry Ford that said, if I'd asked people what they wanted, they would have said, faster horses. Well, he built a faster horse. And actually, if you think about it, have you asked yourself, what's a horsepower? Why do they use a horsepower? It's actually, that's what James Watt did to measure the engine that he developed to steam engine. He's using horses to measure how many horses they could pull, or pull the same power. So now we drive cars that has 200 horses, faster horses, but they didn't inject the horse with steroids to have a faster horse. And that's what we try to do in our dental community and other health communities, is always have the same solution, make it better, instead of starting from scratch to design something. These are different models that have been proposed. Therapists, we hear that a lot. People thought this is the solution. It may be the solution. Every one of them is a solution, but within a system. Advanced dental hygienists or dental hygiene practitioners, community dental health coordinators from the American Dental Association, pediatric therapists, and then the model that says only dentists will do it. All of them will work under the right circumstances in the right system. So I want to give you some insights, simple statements to take with you in the next discussion. No one single provider will resolve the access to dental care problem. Systems will, multiple providers working together. As you have heard from Mark Goldstein has a system. There are other systems now in geriatric care or elderly care that are really systems to reach out to people in nursing homes in a coherent, stepwise process. So remember this statement. No single provider will solve the problem. So we don't advocate for one single provider. The other thing that's happening, and it's not moving, can you move it? Great. The other thing is that we talk about children. Weight right now is going to be bigger than that because half of the growth in the US population are of people older 65 plus. And we don't have a system to provide them good care at home or in a nursing home or in a facility. Some people are starting to think of that model. We are not training our students very well to do that model as well. Oral health and healthcare will not only be provided in clinics and hospitals. We have to move out to, we already know about schools, but nursing homes, elderly homes, where people are, we should go to them. That's one of the solutions. Wherever people go, we go there. But this is important. It's not only clinics and hospitals. Restorations and extractions will not resolve the inequalities in oral health, neither is dental hygiene. And whatever we do is not by itself, piecemeal approach is the solution. Because we have effective system to provide fluoride and sealants in schools. There are companies, when Morgan Stanley buys a company that works in 23 states and have access to 500,000 children, you know Morgan Stanley, they looked at the finance and it's very lucrative. But is that health? Are they achieving the outcomes? We're not. We don't know. But I guess that they were not. Inequalities in our health have deeply rooted social, racial, educational, policy, and economic determinants. So it's very important to remember that it's not just us. It's all the policy structure, all the discussion that's going to happen over the next 100 days after January, and the next 6 months, and the 1 year. We need to address these issues in society, because you look at a relationship between poverty and health, and there's an inverse relationship. The more poverty, the more disease. The value of any healthcare system is to promote health either by eradicating disease or reducing the severity so they can be self-managed. Sean presented very nicely about a model that addresses this one. It's a value-based system. The value is not that we do processes, but we measure outcomes. If you do not measure outcomes and design a system to achieve the outcomes, you don't have a value-based health system. So what Dr. David Kelly says is a reward. If you achieve outcomes, the fees that you're going to receive are going to be totally different than if you don't achieve outcomes. And of course, there are a lot of things to talk about here. If we all agree that health is our ultimate outcome, then we need to develop integrated healthcare systems. I think we have heard this message over and over again. We need a system that's different. Not just in that our system is not working. It works very well in certain segments. We need to address how we do it better. We build on systems rather than eradicate or change the whole system radically. We have a very successful system in many areas. So if the sound strategy is to achieve a goal, as Porter says, sound strategy starts with having the right goal. And if the right goal is not to provide procedures, but to achieve health, that we can say that the percentage of the population disease-free is this, then we have to develop a system that looks at clinical intervention, community-based intervention, policies, and programs. So I hope in the next 2 days you think of strategies to achieve health, because you need to talk more about health rather than access to care and dental care. Oral health is really the ultimate goal. So the oral health team that will include dentists is every member of the whole oral health team has to work to the maximum of their limits, whether by legislation or by training. Dentists will provide advanced care. We need a preventive, I forgot what SPES stands for, service provider, advanced dental hygienist, something, or a therapist, whatever we call the person, diagnosis, behavioral change, primary and secondary prevention. We need to engage the primary care providers, and they will be also part of the system. And we need also community health workers to market and educate at home on location. So the system that I'm thinking about is include all these 4 providers. The slides appears a lot better on my machine than here. So the system, we are entering a system accountability era. There will be a lot of challenges about where we're spending the money and how we achieve these goals. And we cannot just rely on procedures and procedures and procedures. We're doing most of this at Temple. We're focusing on disease management through medical dental intervention. We have a medical clinic at the dental school now, and we're doing a lot of things to integrate both the dental and medical. We're focusing on outcomes. We have defined outcomes for dental caries and periodontal disease. We're going to reward students for achieving the outcomes. We are actually operating a clinic now. It's 3 days. It will be 4 days at a service center, so the students learn how to work in serving a population from 65 to over 100. There are 300 people above 100. I'm done. And then mobile dental care for seniors, that's another learning opportunity. And then there is a care navigation. Without care navigation, the system will not work. You need someone to communicate with people and go out to their homes and follow patients, especially high-risk patients. So I hope I addressed my mission. Is the dentist is a member of the team, leadership is collaborative, and we have outcomes to achieve together rather than one single provider. Thank you.